What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Hi, and welcome to the Inflammation Investigator. Today, I am super excited to introduce you to one of my favorite people. I have known him for, oh my gosh, more than maybe about 20 years now, I
Yeah.
think, that I have been working with Dr. Snyder, who I'm going to introduce you to in a second, and I started working with him to help my son, but we'll get to that in a second. Let me first tell you a little bit about Dr. Snyder. Dr. Snyder grew up here in Colorado, which is where I am based. Early in his childhood, he lived in Salida and then moved to Arvada for kindergarten. He graduated from Arvada Senior High School in 1983. 3 weeks after graduating high school, he started college. After completing his undergrad studies, Dr. Snyder went on to Logan College of Chiropractic in St. Louis, Missouri, where he received his doctorate in chiropractic and certification in acupuncture in December 1988. He began practicing full-time in April 1989 in Westminster, Colorado. He is the past president of Robbie's Friends and the Edge Soccer Club. For the past 10 years, he has served as the team sports chiropractor for Regis University Athletics. So there's a lot going on there and a lot that we're going to kind of unpack and talk about as we go further into our conversation today. But welcome, Dr. Randy Snyder.
Thank you, Elizabeth. Thank you so much.
So today, as we have kind of talked about leading up to our podcast, is that I'm all about inflammation and chronic inflammation. And one of the reasons I really wanted to talk to you and introduce you to our listeners is because I don't think a lot of people connect chiropractic with chronic inflammation. So maybe we should first start off with what is a chiropractor? What is chiropractic? I know a lot of people maybe have been raised in Western medicine and they aren't really familiar with what a chiropractor is and what they can do for you and how they differ from like your regular medical general practitioner.
So, from a chiropractic standpoint, we are looking as the body as a whole and not in just systems. So sometimes you're going to your family doc and or a specialist, and they're the kidney person or they're the lung person. Chiropractic looks at your body as a whole functioning unit. So when you look at let's say somebody comes in and they hurt their lower back or they got in a car accident, they're thinking that's what I'd go see them for. But that's not how chiropractic actually started out. Chiropractic actually started out healing a gentleman from hearing loss. And by adjusting his neck, his hearing came back. Well, we know
Oh
now
my
that more than
gosh.
likely, yeah, we know now that he probably had a plugged eustachian tube. They adjusted his neck, the eustachian tube opened up by relaxing the muscles, and that's how we got his hearing back. And same kind of stuff we do with the little kids when they get ear infections all the time. You do a little light adjustment, their eustachian tubes open up, and they do much better. So that's kind of that zone. So when you look at like a human spine, um, you look at where the nerves come out. It comes, the brain sends a signal down and it goes off all these little zones on your spine, and one goes to your heart and lungs and gallbladder and colon and whatever else. So a lot of people with chronic constipation or chronic, breathing issues, when they get adjusted, it takes the pressure off the nerve and they feel way better. And that's really what we do and focus on with the chiropractic side of our office. Besides the person who's mowing their lawn and throws their back out, we look at the person who is sick and having issues, and we adjust them to get that moving.
I think that is so interesting and essential to understand about chiropractic. I think even when people might be familiar with a chiropractor, they tend to really just think of it as something for an acute emergency. Oh, I threw my
Hmm.
back out, I was in a car
Hmm.
accident, and then they go for a couple adjustments or something, and then they stop. There's also a lot of, I'm going to say, trash talk from the medical community about chiropractors. I think it's because in Western medical school, they really don't teach hands-on work for on the body. They're just, it's very much academically focused. Oh, I'm going to find out your symptoms and I'm going to match them to a disease diagnosis, and then I'm going to match that to a pharmaceutical to really tamp down those symptoms and give you
Hmm.
some relief as long as you take that pharmaceutical, not for healing per se. But I know, even myself, having come from a medical family, that there wasn't really a respect for chiropractors when I was growing up, and certainly it wasn't part of my standard of care growing up as a child. And
Sure.
when I did discover chiropractic in my 30s or maybe even 40s, I felt like I had been denied something
Hmm. Hmm.
essential that I should have known about and that could have really helped me along many parts of my own health journey growing up. So I'm really glad to hear
So,
that about chiropractic.
I'll give you a good example. I had the privilege of playing soccer around the world, right? And I got hurt playing ball to the point it was giving me groin pain, right, in your private parts. Right? It would give me like groin pain, and it would literally fade out, and you'd be like, okay, I'm doing pretty good, and it would come on, and literally you'd be in the fetal position, right? So when I got hurt, they actually flew me from Mexico City to the United States. They didn't want me go to the hospital in Mexico City, right? They were afraid of all that. I literally went to the ER 3 different times. They said, well, you don't have, a bladder issue. You're not having a testicular issue. We can't figure out what's going on. Here's some pain pills. Go home. And that went over like a 3 month period of my life. And I was a big soccer player, and we had a coach who was a chiropractor, and he was over in Applewood, Colorado. His name was Larry Bridge, and Larry coached soccer, and he would take his kids out and watch different athletes train and how we did things. And he happened to come out and watch me. We got to be friends, but he was a chiropractor, so kind of like your background, I just go, whatever, right? And after I got hurt, he's like, man, you're having problems. You're not running well. Your hips aren't moving. You're not doing this. You're not doing that. Well, so long about the fourth time I'm going to go to the ER at Lutheran because I am just doubled over with groin pain. Um, when my mom and one of my friends goes, why don't you go see that guy? And I was like, he's a chiropractor. And so I finally said to myself, you know what? They're going to give you pills. They're going to tell you nothing's wrong with you. Have a nice time. And so I literally went to his office. They took some x-rays of my lower back. He showed me what was wrong. He laid me on the table, and I'm literally basically in the fetal position. I am so much in pain. And he adjusts me, and it was literally like your kitchen sink. The faucet just goes, tss. And I'm like, I've been doing this for 3, 4 months, and that's all we had to do. That's all we had to do. So I went from planning on going to medical school. That's why I got started college so fast out of high school, that I changed the chiropractic, because I'm like, why did not somebody not bring this up to me? My primary care physician was an osteopath. You have a DO and stuff. He didn't
Uh-huh.
say anything about, hey, let's check your lower back and see if there's anything going on. But the history was I ran into a goalpost and I got squished into a goalpost in Mexico City. So I went from one side clear to the other side. And that's how I got into the whole chiropractic side of it, because, nobody even brought it up. Nobody even mentioned it. And then coming from a medical family, about let's say about 40 years ago now, almost 40, there was a big lawsuit. It's called the Wilkes trial. And the Wilkes trials proved that the Academy of Surgeons was bad mouthing on the chiropractic side, and they didn't have the data for it, and they were pushing down the data that was positive, and they lost $400 million in that lawsuit for
Oh my gosh.
yeah. So instead of just saying, yeah, these guys do a great job, they kept poo-pooing it and going from there. Now, one of our largest referral bases now is family practices. They're like, hey, go go try this instead of what you're doing. And so that's a large part of our practice now is medical clinics sending us patients. So,
I find it very interesting because if we look and we know, we start to think about anatomy and how the bones are attached into the tendons, and everything is working together, it makes sense that if something's out of alignment, and that can happen very
mhm,
easily. I remember one
mhm,
time my mom was carrying a box of yarn, and she kind of miss um miss miss what's the word I'm looking for, she was trying to put it on the counter and she missed, and so she ended up jamming herself into the counter, and it like pushed all of her vertebrae like out of alignment. And there's
mhm,
no way that you can bring that back in yourself. You need somebody to put their hands on you who knows what they're
mhm,
doing, which is
mhm,
what a chiropractor does, and
mhm.
realign all those vertebrae. So it really stumps me as to why the medical community would be so threatened by it, but I guess it's probably because they're not taught how to do it.
They're not taught, and they're not taught the science behind it. So that's always the interesting part when I meet with a medic. I
Uh-huh.
remember, I don't know, 10, 15 years ago, I met with a group of pediatricians, and one of the guys was just rolling his eyes. He's like, "Well, chiropractors say they can fix ear infections." He's like, "How in the heck?" And he went through this whole thing about needing antibiotics and the whole bit. And I said, "You ever put tubes in a kid's ear?" And he's like, "Yeah." And I go, "Why do you put a tube in a kid's ear?" He's like, "Well, their ears shut. They're not draining well." I go, "So what's the anatomy?" I literally got up and they had a whiteboard and I just drew the anatomy out. And I go, "When this muscle's tight and this is tight, is it not going to squeeze that tube?" And they're all looking at me and they go, "Yeah." I go, "So we're not doing an antibiotic therapy. We're not doing something to fix the infection. All we're doing is putting the neck back in, relaxing the muscles, stripping that tube a little bit, and then it all drains. If it's draining, they don't have the chronic ear infections, right? That's what the tube's in there for, to try to keep it open." And they just looked at me like, wow. And they were just thinking we were doing some, I don't know, mystical thing. And it's all physics and it's all anatomy. Oh, it was straight up anatomy. And we're like, all we did was loosen this stuff up and things get better, right? If they don't get better, then they need those other therapies. But if it clears them up, I mean, we've had kids, had a little girl that was 10 rounds of antibiotics in just under 3 years for chronic
Oh
ear
my
infections.
gosh.
So we adjusted her. We did laser acupuncture with her. Yeah. And her mom brings her in about every quarter just to get tuned up. And she goes, "We haven't had one since we started." And all it was getting their ears to drain. So,
I
that's how the
think
anatomy
that
works.
I like to remind myself and my clients that medical doctors are doing their best with the tools they have. And the tools they have
Mhm.
are surgery and pharmaceuticals. Well,
Mhm.
those are great and they have their time and place for sure. But there's a lot that we can do without having to go under the knife and without
Right.
having to put toxic drugs and have side effects in our bodies that we can do just to help ourselves. And I think that chiropractic and chiropractors are one of the great tools that should be probably part of standard care for everybody starting in early childhood. And it would be nice if we moved into that model. I'm not sure if that will
Mhm.
happen. We'll have to see. There's a lot of things changing in healthcare right now.
Yeah.
Um, but I know that in your wellness center, you offer more than just chiropractic services. What kind of other services do you offer?
So we look as the body as a whole, right? So we're
Mm,
trying to say what other things got screwed up if we're going through this. So I do a lot of acupuncture. I do a lot of acupuncture that deals with, your knee pain, your ankle sprain, your osteoarthritis, that kind of stuff. We do a lot of acupuncture for that. People look at me and they go, "What else do you treat with acupuncture?" And I go, "Well, the Health Organization lists a whole bunch, and I do all those from asthma to GERD to what all those things, right?" And the people don't have to have the meds. What a lot of people don't realize is a lot of the medications they're giving you for your stomach, over time they actually make you more osteoporotic because it blocks, the calcium blockers block all that kind of stuff that makes your bones better. So you can do something like that on the short term, but not on long term. You may be looking into the root cause of what's going on. I do a lot of allergy stuff that happened. I got involved with that. She's almost like 27, 28 years ago. I do a lot of different things that we researched out and got moving. We have a whole medical side, and that medical side focuses on like neuropathy, which is also an inflammatory aspect, and hormone therapy. So what people don't realize is if you're a female, especially, and you're over 35 and you've had a couple kids, your hormones are probably off now, right? And so let's say I went in and had a hormone test for myself. I'm compared to all the other men who are 60 years old. So you may say, well, you're a little low. I'm a little low compared to 60-year-olds versus how was I at 25 to 40, right? Where were my numbers then, right? And they're much higher. Well, we look at it from the standpoint of if our hormones are low, there's a lot of joint pain and irritation and inflammation that comes from that. There's aspects that you go, okay, what else is bugging them? And a lot of times it's the mood swings, the anxiety, the depression, all these things that people go through. A lot of ladies, when they're going to perimenopause and menopause, feel like they're just kind of, going through a nutso stage. And oftentimes that's just because their hormones are off. I'll give you a good example. One of our neuropathy patients, um, he works with the VA, does a lot of stuff because he's in the military. He's on high doses of insulin because of his diabetes. He's been on insulin for 55 years. So we're checking him
Wow.
for all these different things, and we checked him for his hormones, and he basically has no hormones. He was like in 100 for testosterone. We put him on hormone replacement therapy, and within three
Uh-huh.
months, he's like, I'm basically using my insulin every once in a while, but basically I'm not using it anymore. His blood sugars all came back down. It was a hormonal issue that he
Wow.
was having. So we're looking at it, and then all of a sudden, people don't realize that insulin is great because it helps all these other things. But insulin's a peptide that actually takes the sugar out and turns into fat, right, to keep your blood sugar down. Well, what
Mm.
happens then is then the bigger you get, the more your BMI changes, your insulin gets worse, and they have to have more insulin. So it's just kind of the cycle. So just by putting him on hormone therapy, his cycle came down. He's leaning down because it's all coming under control. But it's been 55
Uh-huh.
years of that, you know. So we do like the chiropractic, we do a massage therapy. We have the acupuncture, the dry needle therapy. They're distinctly different. Um, some of the allergy stuff we do, plus hormones, neuropathy, a lot of the medical side that way. So we look at how the whole body operates as a system and say to ourselves, what else can be going on? Like hormone replacement therapy, big for the brain, right? They're seeing that over and over again. It's brain protective. Um, there are all the new studies that are coming out about hormone aspects. The FDA is taking the black label off hormones, whereas before it was so bad, they realized they were influenced by pharmaceutical companies, and they need to put it back in because, like osteoporosis for ladies, if you start within a couple of years of menopause, you're cranking it. Heart disease for ladies, it drops down 42% if they start within a couple of years of menopause. So there's all these
Wow.
things that involve your own body's inflammation that we try to take care of. Acupuncture is one of the best anti-inflammatory aspects there is. You go in and we do certain specific patterns with people or different things that have going on, and their inflammation goes down and their energy level goes up, and they get more things done in life. They can actually enjoy life instead of being so swollen and irritated all the time.
So one of the things that I'm really focused on in my world is food
Yeah.
sensitivities and food and chemical
Hmm.
allergies. And in
Yeah.
fact, that was really how I met you, was bringing my son for his multiple food sensitivities and food allergies when he was a little kid.
Yeah.
So the way that you approach it is a little bit differently than the way that I approach it in my practice, which is really just with dietary changes. Um,
Mhm.
but I think that there's a time and place for both of these, and they really work together. Will you tell a little bit more about how you got involved in food allergies and food sensitivities and what you do to help with those?
So my background was chiropractic and acupuncture. My goal was to be, traveling with sports teams and things of that nature, kind of like I do with Regis, right? But, and
Uh-huh.
that was my goal, right? But it's amazing what happens, and I always say, what God tells you, that's a great idea. That's not your plan. That's what I got for you, right? And so my daughter was about 11 months old, and I tried killing her off by letting her have mac and cheese off my plate. So my wife and my wife's her best friend took a little baby break, right? So the husbands are watching the kids and leave. So we have the like some hamburgers on the grill and some mac and cheese, some of the easy guy stuff, right? And whatever a little 11-month-old hand can hold, reached out and grabbed, off my plate, stuffed it in her mouth, and my best friend's across the table, and he says something constructive I shouldn't say on your podcast. And he was like, bah! And I turned her around, and her face is swelling up, right? And I
Oh
was
my
like,
gosh.
and my best friend laughed. He goes, "You went from dad to doctor that fast." And so I'm also trained in sideline procedures, rescue procedures, sideline doctor for events. And so I literally threw my daughter at my best friend and ran to my garage and got my med kit to keep her airway open while we wait for the
Uh-huh.
ambulance to get there. So my wife to this day always goes, "Thank God you did it, because it would have taken 4 minutes for ambulance there. She would have had brain damage. She would have died. She would have done whatever waiting." Right. So for the next, 4 years,
Hmm.
if she was going to a party or Christmas or whatever we're going to go to, we'd take the food. My wife had to figure out non-dairy. And this is really weird because after we had her test, it was dairy, soy, and white potatoes. Soy would make her projectile vomit like big time.
Right.
Potatoes just made her grumpy and just irritated. But dairy would kill her, right? Especially the caseinate we found out was what would choke her. So for the next,
Wow.
4 years roughly, we took food everywhere. If we're going on vacation, we went to the UPS store and sent a box to the hotel we're going in case that place didn't have health food stores, or we used to use a lot of rice milk and things like that, just to
Uh-huh.
just to do stuff. So I started researching, found some different techniques, and I just literally sat down and started reading it and going through it. And I'm like, let's try this. And literally, the medic who was working with us, the medical doc who was an allergist, goes, "Randy, this is not going to work. It's not going to work. So why are you bothering?" And I go, "Because I can't trust that she won't end up in the hospital, because the first time was 11 months old. Somebody gave her a Cheeto at a party to give a dog, and that was the next time she was hospitalized. Somebody
Oh.
gave her an somebody gave her an ice cream bar, even though at the preschool it said no milk, no, cheese, eggs, whatever it
Hmm.
is. And then they gave her an ice cream bar because it didn't say no ice cream. And it's like, well, what's
Right.
ice cream made out of, right? And luckily, she was at a preschool that was about 2 blocks east of Wadsworth on 38th. So the teacher actually, and the reason we picked that teacher, she had peanut allergies, so we know she could give the EpiPen shot. So she stuck
Uh-huh.
my daughter and ran past everybody else and put her in her car. No car seat, no seatbelt, who cares, right? And drove her 4 blocks west to Lutheran. So it wasn't like, crazy stuff. We started doing the technique. We have her retested. Medic's like, it's not going to work. And we went in there and all the scratch tests were gone. And he goes, "Well, it must have been a false positive." And I go, "A false positive means a test says you can't have peanuts, but the person eats peanut butter sandwiches every day. That's a false positive." And he goes, "Yes." And I go, "Every time she has cheese, she's in the hospital. Yeah, I can milk her, whatever." And he goes, "Yeah." And I go, "So it's not a false positive, it's a positive positive. What happened?" So we started giving her incremental things, and we got it to go away. So that's our story of how I got involved with it. Because you try to, if you want to do something in your life, but something else happens, you have to figure out how to fix your kid, that kind of
So
stuff.
you explain how this actually works. I know with little kids you can use acupressure, and as
Yeah,
people get older you use acupuncture, but what is it about the specific, I mean, not just any old acupuncture is going to work.
yeah. So there's specific points you use that reset the body. They're called the gate points. And basically, what you're trying to do is get that person's body to realize, hey, it's just milk. It's not arsenic. Okay? It's not.
Uh-huh.
It's a glass of milk. It's not arsenic, or it's
Not
just
poison.
yeah, it's not a poison, right? It's like grass is not a
Uh-huh.
poison. You shouldn't swell up and can't breathe in the summertime. It's not a poison. It's just grass, right? So there's specific points we use, some different body stimulation stuff we do, and it works extremely well. And I never thought that would be part of the practice when I first started, because it was all going to be sports medicine. But then
Uh-huh.
again, literally out of the top 10 patients, my first 10 patients that walked in my door, 4 were terminal cancer, including a little boy. And that's where
Oh
Robbie's
wow.
friends came from. Well, I was president of that camp. So it's just an interesting thing. But here's the deal, like, and you know this, but your listeners probably don't. Foods, environmental, cause a
Hmm.
swelling reaction, right? Histamine
Hmm.
reaction. So that's why everybody goes and takes their Benadryl, their Claritin, their Zyrtec, whatever. Is what you're trying to do is you're trying to stop the inflammation that was caused by whatever you're exposed to. Okay.
Right.
But then there's sometimes, and you've seen this with your patients, it's one thing like with my daughter when she explodes and it's pretty easy to see, right? Other times people are
Hmm.
just getting joint stiffness and pain, some low-grade headaches or headaches. They're having some breathing or bowel issues, and they're not associating it with something they're around or doing, right?
Right.
So when we're doing acupuncture and allergy aspects and things that we do, it's literally trying to turn your body's inflammatory response off to those things. And then all of a sudden people go, hey, my elbows are better, my shoulders are better. Things are better because they're not having an inflammatory response. So one of the examples I give, and I probably gave it to your son this too, is you sprain your ankle, it puffs up, right? You
Right.
know it's irritated because you look down and my ankle's all puffy. So it's pretty easy to
Right.
see. You eat,
Uh,
you don't feel good. And some people are like, yeah, I'm kind of gassy, I'm bloaty, I just don't feel great. That's that same reaction. It's just not in your ankle. It's now in your gut. It's somewhere else that's causing that inflammatory response to happen. So where you've seen through the years with myopathitis is we're just trying to get that inflammatory reaction to stop. And if it stops or greatly calms down, their life changes.
It's true. So for my son, I love to use him as an example because he had so many issues as a child. And
Mhm.
we did, once we finally figured out what was going on in his diet, all these things that we thought were super healthy for him, like broccoli, like lemon, like garlic, were actually causing him inflammation. And so we changed his diet, but it was very restrictive. And at 6, 7, 8 years old, he would feel very depressed about what he couldn't eat. And coming in to get the acupuncture with you, we were able to bring things in very strategically. So I remember before Thanksgiving one year, we were like, okay, we need to work on turkey. And it took 4 visits with you to get him to be able to clear that turkey from his system and be able to enjoy turkey at Thanksgiving. Um, we did not only foods with you, but also environmental things. Like we did dog allergies. And one of the big things for my son was motion sickness. He would throw up on every airplane we ever gone on takeoff and landing, and car sick all the time. And we went in and we did a motion sickness treatment with you, and acupuncture, or at that time it was acupressure, motion sickness treatment. One time he has never thrown up on a plane again. Just really, really amazing. And I like to remind him of that. Like it's not that he always feels great on a plane, especially if there's
Yeah,
turbulence.
yeah.
But I mean, I used to bring 2 changes of clothes for him on every plane trip because it was a guarantee he would be vomiting on takeoff and landing.
Mhm.
And
Mhm.
he used to vomit so much that he was, even at 6 years old, he could hold the bag for himself and he would find the
He knew it was
nearest trash can.
he he knew it was coming. He knew what was happening. Yeah,
He knew it
yeah,
was coming. So it's
yeah. So
not only just foods, it can be also chemicals or environmental things, like you said, with grass or other type of allergens that are in the air. There's so many different things. And even in the last couple of years, as I've been working with you with the acupuncture, for me and my multiple sclerosis, we've done treatments for things like neurotransmitters and brain
Mhm.
anemia, which just blew my mind. I didn't even know that that was possible to affect those kinds of things with
Mhm.
these kinds of treatments that were non-pharmaceutical.
So so let's take a step back and
Okay.
we can talk about this. When you look at acupuncture, everybody thinks it's like this mystic energy thing, right? And it's not. There's
Uh-huh.
actually devices out there, and you can actually, if you have an ohm meter at your own house, you can measure acupuncture points, and you can actually see how energy moves in your body. You can take somebody who has a scab, or you cut your leg shaving, or one of those kind of things, and you can actually put the ohm meter on there, and you watch the tag tick off. That's the energy your body uses, right?
Oh,
Well,
wow.
your brain
Uh-huh.
is electrical, right? Yeah, we know the brain. There's
Right.
all this, all the matter and stuff that's going on and everything else. But when you say go, an electrical current goes from your brain to your finger, and it makes your finger go.
Uh-huh.
Okay, everything kind of revolves around that, and that's where acupuncture comes in. So there's been some really interesting studies, and one of them was done by a gentleman. If I remember right, it was UCLA or USC. I want to say it was UCLA. Got hurt in China. They did acupuncture, and he's like, my ankle felt way better, but it was interesting. My eyes got better. Right? And they're like, what the heck's that all about? So he came over and he was kind of like going to disprove it and just kind of, check it out. And so
Uh-huh.
they put the person in a beam test. It's kind of like a test that measures your brain activity. So
Uh-huh.
if you were to look at like your nightly news on TV, especially the summertime, you have the
Uh-huh.
no rain, you have the green rain, and you have the like the severe thunderstorm starts going to red and white and that kind of stuff, right?
Right.
And so they're like, well, why would my ankle get better? And one of the points they used was down on his foot. And so
Uh-huh.
they put him in the beam test. They shine a light in the guy's eyes, and they watch the part of your brain, the cerebellum area, light up. Okay. They go, okay, but it was like a mild thunderstorm light up. They go back down. That one of the acupuncture guys goes in and sticks that point, and all of a sudden it's the severe thunderstorm. They don't know how or why it's all interconnected, but when they needle that point, the part of the brain that lit up with flashlight was way bigger, but the same area. And so everybody's like, well, if it's vision, you got to be hitting all the vision points. And sometimes you're like, no, that has nothing to do with it. Some of the main migraine points I use are on top of the feet, right? And I always tell people it's kind of like the deep rock water jug, it's sitting somewhere,
Uh-huh.
and you pull the lever and it starts bubbling, to make that gurgly sound.
Uh-huh.
Well, in the acupuncture medicine, sometimes we're doing points that are really low, and it's just pulling that pressure out of somebody's head. So as I did more acupuncture, as I got certified, you're trying to make it wrap around the medical model, and it
Uh-huh.
doesn't. It,
Uh-huh.
it goes by how the old Chinese guys have mapped it out and told you how it works. And the longer you do it, you go, that's why it's been around 4,000 years. They had it figured out. They've had it figured out forever because they finally just gave it and said, what's it doing? So
Right.
that's how it
Right.
goes.
And it can be, I remember when I first realized that all matter is actually energy and it's all in
Hmm.
motion all the time, even though it feels solid. That was so mind blowing for me because that wasn't
Hmm.
something I feel like from the beginning of first grade, we should be understanding how matter works and how the bonds between atoms vibrate and how it
Hmm.
all structures together. But instead, it took me till I was like 30 years old to figure this out and understand that it's all energy and really the
Yeah.
whole universe is all about energy and health
So
is all energy.
so here's another thing. So yes, some of the stuff we do in our office, we
Uh-huh.
have two really nice PEMF machines, PEMF, which is pulse
Right.
electromagnetic field therapy. And so basically what that does is it exercises your molecules. When people don't have a lot of energy and they're worn down, you can put them on these mats and you pump energy into them and people feel way better. You can do it for a neuropathy, you can do it for a shoulder pain. A lot of patients just do it to relax and get calmed down. We use it for incontinence. It's one of the best things to slow down or stop incontinence for ladies especially. And it's just using your energy to fix the energy that your cells have lost over time, right? So I'll give an example of that too. Let's say we took your son when he was 6, and we
Uh-huh.
actually did a graph on him, right?
Hmm.
And literally, I'm just going to use my arm here on your video, but let's say it's 0 to like 200, right, on the other side.
Uh-huh.
And we could touch all these acupuncture points on your son at 6 years old. He would go from 0 to 200, 0 to 200, right? You start
Uh-huh.
getting in your 40s, and it's 0 to like 110.
Uh-huh.
0 to 110. You look at our parents, right? My mom's 92, I have an aunt that's 98. Your mom is up there a little bit, right? Not that bad.
Yep.
But then you go, okay, and you measure their points, they go, and they're here, right?
And they
We
only go
know
up
as
to
we
like
get,
40.
yeah,
Uh-huh.
and we just know that as we get older, we lose energy. You're tired all the time, you're having all these other issues, but you can actually
Hmm.
measure when people are having a hard time. And I've measured people that have cancer and they're on their deathbed, and you're literally measuring it and it just goes, I mean, barely moves. And he kind of tells you their energy's gone, they're done. And they don't have anything else, right? But it's interesting when you take a kid and it's just like, that's why they're running around the house all the time and, doing their thing because they have that much more energy in them. So it's not mystical. You can actually take a basic ohm meter and measure it and learn a lot of stuff about people.
So I feel very lucky that I live here in Colorado and your clinic is here. And I know there's other practitioners out there who have other clinics
Yeah.
that people can find local to them. But I also know that you offer these intensives where people literally fly in and spend a week at your clinic and do
Hmm.
multiple therapies during the week. For example, my cousin who lives in California had all sorts of issues after a taking a header over her bicycle and landing on her face and getting a migraine or concussion and having migraines that continued to affect her for a very long time after that. And she came out here, and I remember she came and did an intensive with you. So every day she would come into your clinic. And one of the
Mhm.
things that you would do with your chiropractic that not a single other medical doctor ever did was literally touch her head and feel the seams between the bones and realize that they were
Mhm.
had been all jammed together when she hit her head in that initial accident. And in all of the doctors and emergency rooms and surgeries and interventions she
Mhm.
had, nobody had ever literally
Touched
put
her.
their hands on her head.
Yeah. Yeah. So kind of going back to that whole sports medicine scenario, right?
Uh-huh.
Um, I have my middle child, my oldest son, excuse me, is a high-end athlete. And he was in a state championship soccer game, and he saw the guy coming to slide tackle him, so he hopped over, but as he's falling, another guy tried to hop him and literally kneed
Oh,
him in the side of the head.
oh,
So he ended up in the hospital. He's got the whole concussion thing going on. It's like, okay, it should have fade. We did some acupuncture with him. We did, some adjusting with him. And 4 months later, he really wasn't that much better, right? And they're all like, well, it could take up to a year. And here's my college magna cum laude kid, the kid that's always over the top, super smart kid. And he literally couldn't listen to the radio. He couldn't go to the movies because if it had CGI, it would make him throw up.
uh-huh.
It had all these other symptoms and it changed his personality, right? So I prayed about it a lot and I kept searching for anything else. I took him to the neurologist. They were like, yeah, give it a year, right? And you're like, well, the kid's miserable for the year, right?
Yeah,
And
yeah.
one person's name kept coming up, and he's now passed away, but one guy's name kept coming up. It was named Roger Turner out of Toronto. And he
Uh-huh.
taught a thing called CATS, cranial adjustment Turner style. And
Oh,
one of the reasons your medical doctors never got looked into it, because it wasn't really taught this way in chiropractic school either, was research from the 1800s, like 1890s, on
uh-huh.
cadavers. When they take the skull, they go, it doesn't move because you got all these little sutures that are all stuck together. Well, come to
Uh-huh.
find out, there actually is blood and nerves and arteries that flow in those creases, right? And when the gentleman won a Nobel Prize for this, is that how, like, say, the side of my head here,
Uh-huh.
it goes in and out about 2 millimeters. While it
Uh-huh.
goes out, basically, think of it this way: the front and back go the other way, and it's a pump
Uh-huh.
that helps pump cerebral spinal fluid up and down your spinal cord, right, and around your brain. So
Uh-huh.
that pump is there to give nutrition to the brain. That's what keeps the fluid moving. So you get fresh stuff all the time, right? Get rid of the toxins, but
Mm-hmm.
fresh sugars and everything else. And so I took my son Nick up there and I said, hey, I want to learn your technique, but I like to bring my son. Would you mind seeing him? So I'm not just practicing in my son. And he goes, I'd
Right.
love to. So my son was in a room with 50 doctors and they put him on a table with cameras and stuff. And my son is like, what is going
Uh-huh.
on? And Dr. Turner
Uh-huh.
treated him at lunch and talked through it, the whole thing, like a grand rounds. And
Uh-huh.
Nick goes back to the hotel room. I'm in the course learning this stuff. He comes back at dinner just for his second treatment, and they look at Nick and he goes, "How you feeling?" He goes, "Well, I haven't had a headache since about 10 minutes after the first one." I go, "What?" Right? And so here's a kid, high-end athlete, travels, all that
Uh-huh.
kind of stuff. He played 10 days later because
Wow.
Roger treated him 3 times. I learned from Roger what to do, but then I literally the blessing I had was here's the guy who treats a lot of autistic kids, a lot of handicapped kids, all these different things, right? Besides injury people. And
Mm-hmm.
I'm like, is this how much pressure my is he using? My son's like, way low. That's too much. And we see he would tell me how the master was doing it. And I've been doing that. He was like 16, so I've been doing that like 12 years or so. But I got into the
Uh-huh.
cranial stuff. So whenever somebody has head injury, post-concussive, still having lag, you just see if
Mm-hmm.
everything's moving correctly and then change it if it's not. And all of a sudden the blood supply changes, the fluid movement changes, and it goes from there. You may know a little gal in my office named Paige, right? She's a little smaller
Uh-huh.
gal. She's been my
Yep.
scribe for like 6 or 7 years. How she became my scribe was because when she graduated high school, she came to work with me because she had a massive concussion in high school from soccer,
Uh-huh.
right? So a year later, they find me and we straightened her out. So she just got married about 3 months ago. And her mom gave me the biggest hug and she goes, if it wasn't for you, she wouldn't be here because it set off anxiety, set off all this stuff. And I'm at her wedding, right? Do the whole dance thing and everything else. But her mom's like, if you wouldn't
Uh-huh.
have done that, she wouldn't have been here. And we would have had this daughter that was still not functioning after a year. So God just says, you can do whatever you want to do. I'm going to throw this wrench in it. And then you have to do what I'm telling you to do. And that's part of that.
Yes, yes. I think there are so many things that can be treated with, I'm just going to call them natural and alternative modalities
Yeah.
versus pharmaceutical or surgical modalities
Mhm.
that we may have given up on. We may have decided, oh, well, this is just how my life is going to be. I'm always going to have this pain. But there really is so much more that can be done to help you so that you don't have to live a life of pain and restriction just because you are right now. That you can keep exploring and keep trying out different modalities, and there are lots of them out there, and you can find a practitioner like Dr. Snyder, or you can come into Colorado and do an intensive with Dr. Snyder, and it can change the rest of your life. So I
Yeah.
want to, oh, go ahead.
Well, I'll tell you an interesting story.
Okay.
There's this every couple of years, there's
Uh-huh.
this meeting that happens at CSU, right? So that's a big
Uh-huh.
corporate scenario. And I
CSU,
don't
by
know
the way,
how
is Colorado State
yeah,
University.
Colorado State University in Fort Collins, about
Okay.
what, I don't know, 90 miles from us, somewhere in that zone.
Right.
Anyway,
Right.
I started getting patients from this conference. One of my patients I had fixed started sending people. And so I got this lady, and she is from
Uh-huh.
Orlando, and she flew in from one of those intensives. And she literally came in, and you walked in, and it's like, okay, she's from Florida because she's like super dark tan, right? Kind of
Right.
thing, right? But it didn't look like a healthy. It wasn't like a good looking tan. If it makes it just was the
Uh-huh.
wrong. It was the wrong kind of color, right? And
Uh-huh.
so, come to find out, she is somebody that's allergic to nickel. Well, she had a dental implant done, and they actually removed it within a month because the nickel inside her mouth set off this whole autoimmune scenario. She hadn't
Wow.
worked in 2 years. She could barely function. She was only awake like 3 to 4 hours a day. She with
Uh-huh.
this, and she goes, "No, I'm pale white. This came from the." She started changing colors, right?
Oh,
After
wow.
right after the deal. So I go, okay. So Paige, the little gal I was telling you about, she is always like, he loves this because it's not just your standard neck or whatever, right? I just love that kind of
Right.
stuff. So we went through and figured it out, and she did a week-long intensive with me. Went home for 4 to 6 weeks, came back for a week. 4 to 6 weeks, came back for a week. Before she left, the color from her knees down and elbows down was back to white. It was the weirdest thing. So she was ghost. She was back to her like me, ghost white.
Uh-huh.
The second intensive, third intensive, she comes back. She goes, I just want to be checked. I want you to needle me, do whatever you want to do. And then she comes back about once a year just to get checked. But her skin color came back to normal, started working her stuff. She started doing all those things, but she flew in from Orlando. And I'm like, that's a weird referral. But I've got them from Japan and Hawaii, and I had a weird one from Saudi Arabia. I fixed a
Yeah.
kid. I fixed a kid from Colorado, University of Colorado. And he goes, man, I wish
Uh-huh.
my mom could see you. And I'm like, where's your mom lived? And it was somewhere in Saudi Arabia, he said. And I go, I was like, yeah, it's too bad. Then like a month later, he's there with his mom. Well, I didn't realize they had the money they had, and she just took one of the private jets and came over and did a month-long intensive and straightened her out. So it was just one of those things that you don't think your practice is going to be focused on. I thought it was all going to be sports med and chiro and some acupuncture for sports med to what it is now, and people that fly in and I mean, I got so many people from Wyoming and Nebraska and New Mexico, just people who drive that far. It's an amazing thing that you've been blessed to be able to help people.
So, are there any other dramatic stories of chronic inflammation that you'd like to share with us as we start to bring this to a close?
We had a little girl from Wyoming, and
Uh-huh.
she would literally scratch herself half to death all the time. She was just spotted everywhere, right? And scabs. And they live on a ranch. So like, is it pesticide stuff? What is going on? And I literally sent the mom home and I said, here's what you need to do. I want you to just write down everything she's involved with. right? And she was literally like 3. So she's, just playing basically.
Uh-huh.
And we did some treatments and she got a little better. And then her mom came to me and she handed me a bag of stuff. And she goes, I'm wondering if it's this. And I go, okay. And so what it is because she's little, they're called bucket calves, like the baby calves on the ranch, right? And they have a
Okay.
scoop, like a little small scoop, and they put this powder, it's colostrum type of stuff, into the buckets so the baby calves get more food, right? It was the
Okay.
colostrum that she was scooping that was blowing her up. So
Oh.
she had spent a year on every salve you can imagine, all the different things the medical doctors were trying to do in Wyoming. And they came down and it took us a little bit to figure out that's what it was. As soon as we treated her for it and got it off of that stuff, phenomenal. Um,
So
we
the
had a little
mom
girl.
was scooping it or the child was scooping it?
The child was scooping it. So they had like a little, like those little Fisher Price buckets,
Right,
a little
right. She
scoop,
was
and her
helping
job
out
was
on the ranch.
just helping
Uh-huh.
and doing stuff. And that was the stuff that blew her up.
Wow.
Um, but a girl that came in, her parents knew somebody in town that talked to them, and she came in from Hawaii, and she literally she had scabs that came all the way down her arm, right, just on the
Hmm.
left side. And her parents, when I talked to them, they're like, we wrap it, we do everything. In the middle of the night, she's scratching it. So the parents are like, all right, must be dietary. We got to make sure she's eating the right stuff, blah, blah, blah. Right. So we go through and figure out that it was citric acid. Right. And so what do you eat in Hawaii? Well, you eat pineapple and star fruit and all that, all the stuff that all of us would be like, that's the healthiest thing. So mom and dad are
Uh-huh.
making sure she's eating healthy. That one healthy thing was blowing her up. And those are the kind of things that you just go, hmm. Now, what people don't realize is foods and environmental, like you're talking about, also
Hmm.
affect kids and people's emotions, affect people's energy levels. So
Yep.
you have somebody who is allergic to red dyes, right? That kid may be the sweetest kid in the world, and then they have certain candies that have red dyes in them, and now they're a beast. They're a beast in school, they're a beast somewhere else, right? And you know that you say have to modify their diet, do some stuff, and get them away from those scenarios. But a lot of parents just don't realize what's going on, and they just have a really unruly child. Well, you take the inflammation away, that's inflaming their brain, and things get better. So one of my best friends, his daughter, he thinks this is the coolest thing ever. So he sends me patients all the time. And his daughter was at our house, and she was just the sweetest thing. And they were having like a birthday party, so it was like a pizza night thing or something. And she's eating pizza. And the next thing you know, man, she was just wanting to smack everybody, adults, but she was just ticky. And he's all over her. And I go, bring her to the office. It's either the cheese or it's the spaghetti sauce or it's the wheat, whatever it was. And it was just citrus. Well, then they started putting together when she had problems at school. What was her lunch? What was this? And it was the citrus that was making her just agitated. Right. So sometimes it's
Orange
not,
juice. Uh-huh.
it was orange juice and things like that. An orange, let's say anything that's like a sour candy, like your Sour Patch Kids, hard
Oh,
candies like your
right.
Jolly Ranchers, that sweet, sweet, is citric
Yep.
acid, right? And so
Right.
they took all the citric acid stuff away, and here's her little angel again. But for her, that was something that just irritated her. So when you're talking about the inflammation of a body, you're talking about
Uh-huh.
modifying their diet, changing some stuff, detoxing them. That's the stuff that if a parent really pays attention to what's going on and they have an angel, then they have a beast. You back it up and go, what they eat, what they get into, what were they doing, and then start playing the game of taking it away from them.
Yes.
So
It can be tricky because it can take a couple days sometimes for that to show up.
mhm.
It's not always like immediate. Oh, they just had that half an hour ago. Might have been
Yep,
something they ate yesterday that is causing
yep.
their ADD or whatever it is, hyperactivity going on or sullenness, things like that.
Well, Elizabeth, you've treated patients with gluten intolerance, right?
Yep.
And some
Yep.
patients, some patients with gluten intolerance, they get into bread, whatever they got into, right? And they're like
Uh-huh.
running to the bathroom, they're like miserable. The other person has it, and they just feel like that girl from Charlie and the Chocolate Factory, where she just kept ballooning up, right? And
Violet.
they come,
Uh-huh.
Violet, and they come in going, "Look at my stomach, I just feel horrible," but they're not cleaning out. Their reaction to gluten is that type thing.
Right.
So
The
it's like you said,
swelling.
they can and
Uh-huh.
they can have it for like a week, right, before it starts to get
Right.
better. And that's where you and
Right.
I look at people and go, hey, your body's inflamed because you did something to it. You put something in it. You did something, right? And let's see,
Right.
we can stop that, that kind of stuff.
One of my pet peeves is when people come to me and they say, well, my problem is that I'm too stressed. And I'm like,
Yeah.
I don't think stress actually can cause a problem. It can make things worse, but I don't,
Hmm.
there's something that's triggering the inflammation and
Hmm.
before the stress. That's what's
Hmm.
causing the stress, really, in most
Hmm.
cases.
Hmm.
Um,
Yeah,
and I
totally.
feel like it's a cop out that a lot of medical providers will say, well, I don't know what's wrong with you. It must just be stress,
Hmm.
right?
Hmm.
Must just be stress. You should go
Yeah.
meditate.
Yeah. Yeah. Go meditate and take a nice long walk, right?
Right,
Well, my
right.
first thing when somebody comes in is like, have you had this for a while? Not a month. So what have you done different the last month? That's my first thing, right?
Yep.
You don't get a chronic illness in the last 4 weeks out of just for whatever reason you can't eat something, right? Then maybe they caught COVID and that irritated things. Maybe they caught the flu or there was something like that. And you can get an allergy from really weird things. I got an allergy to strawberries because I had been exposed to the chicken pox so many times. Worked with inner city kids the whole bit, and everybody goes, "You just must never gonna catch chicken pox because it never bugs you." Well, then the
Uh-huh.
first day of the Nagano Olympics, I'm like 30 years old, and this came on, and I had the chicken pox. And I'm like, "What the heck?" Right? And I had worked with some folks. Well, then I used those Dole fruit bars because they could swallow them easier, but I have a tendency to like the
Oh,
strawberry ones. So as my body
uh-huh.
was making the antibodies and all this stuff for the Dole fruit bars or for the chicken
Uh-huh.
pox. It was making it for Dole, and I was allergic to strawberries after that. So I had to get treated for
Wow.
strawberries, but I could eat bowls of strawberries before I got sick. But I was making those two things at the same time, and it didn't work for me. So those are those kind of things. So
Yeah.
I hope you learned something today. I mean, you and I have talked before about different things. I hope you learned some different things today about our practice and what we do and just the blessings, bless people. And so we just kind of keep, trying to get people's lives back and have it so they can function and do what they want to do, from little kids to older adults. Probably the one I have a little senior citizen. She just moved to Colorado Springs, but she probably
Uh-huh.
sent me 20 patients because I fixed garlic. And she couldn't
Oh,
have garlic, and the senior center would always put in garlic powder or garlic something to give some
right,
flavor, right? And she had to
right,
spend the time in the restroom. And they thought they remembered not to keep it out, and they did. So
right.
I worked on her and got rid of her garlic allergy. And that's one thing. And I didn't have to treat her hard. And she sent patient after patient. It's like, go try that. Go try it for ice cream. Go try it for whatever. And it
Right.
makes people's lives change because they can do what they want to do.
Exactly. So what's the best way for people to get in touch with you if they want to learn more or maybe
Yeah.
schedule an intensive or even just an appointment with you?
So the best way is just call the office. They want to schedule an appointment. Like I said, we're in Westminster, Colorado, which is about halfway between Denver and Boulder, kind of at the 10 o'clock zone.
Yep.
On the screen, if they can see it, our website is lthaw.com. So it stands for Lifetime Health and Wellness, and we changed it to Lifetime Healthcare and Medical. But that's our website, and you can see a lot of stuff on there about what we do, as well as our phone number. But we have three chiropractors. We have a nurse practitioner. We have medical injectors and phlebotomists, and we have a DO as well. And they focus on your health to get things going, and try to figure out if there's something we can do. Um, I mean, just let's just say if somebody has MS and we can't
Hmm.
get rid of all the MS, but we take and get rid of 50 to 80% of their symptoms. Is that life changing for them, right?
Yeah.
Somebody who has chronic pain and they're on gabapentin or Lyrica, they're on all these meds, and those things just slow your brain down, so you're kind of in slow motion all the time, right? Well, what if we could just help their situation to where they're taking 80% or 75% less of those meds? They're not going to be as tired. They're more functioning. They walk better. They get their life back. And that's really what you and I do in our practices is go, okay, see if we can get rid of it, or can we just greatly improve it so you can get on with life and have fun with your grandkids or with your husband or wife or whatever, and just make it so they can do well.
Yes. Hear ye, hear ye. I agree
Here. Yes. Yeah.
wholeheartedly.
Yep.
Right?
Yep.
That's what we need to do. There's no reason that anyone needs to spend their life in pain all the time and dysfunction. So that's one of my goals with this podcast, is to encourage and inspire people to go out there and find different solutions maybe that they haven't tried
Mhm.
that can really make a difference in their lives. So
Mhm.
if you can see this on your screen, if you're watching the video, you can see the contact information. But if you are just listening, I just want to say the phone number is 303-423-4610. And it's Lifetime Healthcare and Medical, but the website is LTHAW for Lifetime Health and Wellness, which was the previous name of the practice,
Yep.
.com. So, Dr. Snyder, thank you so much for coming on today. I really hope everybody got as much out of this conversation as I know that I did. And I know that you have a very busy schedule, so I really appreciate your time.
You're more than welcome, Elizabeth. And you know, you and I always have fun times where we talk anyway, and
We
sharing our,
do.
our different approaches to stuff. So it's always nice to have other holistic providers out there going, no, we have more to offer than just pills all the time, you know? And
Yes.
yeah, all those things that are the counteractor to the next thing and the counteractor to the next thing. You don't need all that stuff. See if we can get it down to we have one bottle of pills instead of six, or take cut everything in half. But then your life changes because you're not having all the side effects. You're not having all the garbage that goes with that. My best friend's a DO, and it's funny because his kids all see us, and his friends in the emergency room all see us. So it's fun to open their eyes to all the different things we're doing and having fun. But it was a pleasure sitting and talking with you. If you need something else in life, just give me a call. We can always talk some more later.
Oh, well, I'm sure I'll be in to see you sooner rather than later in general. Thank you
All right.
so much.
You're
And
welcome.
until next time, thank you all for listening.
Thank you.
Okay, bye-bye. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations: they work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.